Hello everyone, I hope you are all doing well. In this video, I am going to explain how to write an ultrasound report in a simple and correct way. Let's get started. Ultrasound report writing is one of the most important part of sonography, dear student. If it's written correctly, it helps the referring doctor understand the case easily, and it also shows your professional level. In this lesson, I will explain how to write a proper and standard ultrasound report from the beginning to the end.
Steps of ultrasound report writing. Patient information. The first part of the report always includes the patient's information. Example, name Fatima Bibi, age, sex, 32F, clinical history, lower abdominal pain for 2 weeks. Technique. In this part, mention how the ultrasound was performed. Example, ultrasound examination of the abdomen was performed using real-time. B-mode sonography with a curvilinear transducer. Findings. This is the most important part of the report. You should write your findings in an organized way from the top to the bottom of the body, or according to the organ being examined. Example, liver, normal in size, shape, and echo texture. No focal lesion seen. Gallbladder, well distended. No stones or wall thickening seen. Common bile duct, normal in caliber for millimeters. Common mistakes. Writing and clear phrases like looks normal, using informal words, or listing findings in an unorganized order. Impression, conclusion. Write a short summary and possible diagnosis. Example, impression, normal abdominal sonogram. Impression, cholelithiasis without evidence of cholecystitis. Signature name. At the end, write your name and signature. Example, reported by Dr. M. Sayer Amity, radiologist, sonologist. Standard report format. 1. Patient information. 2. Indication/clinical history. 3. Technique. 4. Findings. 5. Impression.
Lesson. Rules of ultrasound report writing. How to write a correct and professional ultrasound report. Rule 1. Always write what you see, not what you think. Only describe the images shown on the screen. Do not guess or assume a diagnosis. Correct. A hyperechoic focus with posterior shadowing is seen in the gallbladder. Incorrect. There is a gallbladder stone. If not 100% sure. Rule 2. Be clear, complete, and concise. Your report should be clear, easy to read. Complete, include all organs examined. Concise, not too long or confusing. Example, liver is normal in size and echo texture. No focal lesion seen. Rule 3. Mention normal and abnormal findings. Even if everything looks normal, you must say it. This shows you checked all areas carefully. Example, both kidneys are normal in size, shape, and echogenicity. Rule 4. Use standard medical terms. Always use international ultrasound language, such as echogenic are hypoechoic or anechoic, homogeneous are heterogeneous, well-defined or ill-defined, no abnormality detected. Don't use local or unclear words like looks okay or seems normal. Rule 5. Never give wrong or guess diagnosis. If you are not sure, write it professionally. Findings are suggestive of. Further evaluation is recommended. Image quality is limited due to bowel gas. This keeps your report safe and professional. Rule 6. Keep the order of report. Always follow this international order. 1. Patient information. 2. Technique, which probe or method used. 3. Findings, describe each organ. 4. Impression, summary or possible diagnosis. Rule 7. Write the impression carefully. Impression equals final summary. It must be short and based only on findings. Example. Ultrasound findings are suggestive of fatty liver. Wrong. The patient has fatty liver disease. This is a medical diagnosis, not ultrasound finding. Rule 8. Keep your language professional. Avoid emotional, confusing, or uncertain language. Use neutral, medical-style sentences. No evidence of mass or fluid collection. Everything looks fine. Rule 9. If you don't know, refer. If you are unsure, write. Further evaluation with CT, MRI, or follow-up scan is advised. This is a sign of professionalism, not weakness. Rule 10. Double-check before you sign. Before completing the report, check spelling of medical terms. Check all organs mentioned. And make sure the impression matches the findings.